Hi, my name's Dacry, and today I am going to talk to you about bacterial plaque and the proper way to brush and floss your teeth. So, I have some mouthwash here for you. If you could swish that for me while I get washed up. And the first thing I'm going to do is talk to you about plaque, what it is, what it does, diseases it can cause, that kind of thing. The plaque is a colorless, sticky, soft substance that sticks to your teeth. A lot of people think that food is plaque, but it's not. Food is food has the bacteria in it that then sticks to your teeth and causes decay and cavities. The bacterial organisms then live in the plaque and they multiply, and if they aren't taken care of, then they will cause the diseases. Some of the diseases are decay is the first thing, and that's basically just inflammation, and then cavities will eat away at your teeth. Then that can turn into gingivitis if it's not taken care of, which is swelling and bleeding of the gums if during brushing and flossing, and then the teeth can also, or the gums can pull away from the teeth and cause more bacteria to get in there, which then can lead to the periodontal disease, which is tenderness of the gums, bleeding. The tenderness is, they'll be really red. It can cause your teeth to be loose or start separating, and then it'll also give you pain and pressure when you're chewing and eating. And then also you could get pus in and around your gums and your teeth. So doesn't sound like too much fun, so it's important to make sure that you brush and floss properly, and it's important to do this every 24 hours, because after that then the plaque can start to turn into a more permanent thing on your teeth. So even though you can't remove all of the plaque, it is important to make it as minimal as possible. So I will show you the proper way to get your teeth brushed. I have a little model here, and you want to make sure that when you're buying a brush that you get a soft bristled is what I would recommend to keep your gums it's not as hard on your gum tissue, so it's less damaging. And then it's important to change it at least every 3 months, if not sooner. Sometimes the bristles can get really frayed on the ends, or you can just see that they're dirty, or if you see anything like that, then you'll want to change it more often than every 3 months. There's thorough brushing and there's social brushing. And the thorough brushing, I'll start with social. Social brushing is just on the surfaces mostly of the teeth, and it's the gritty stuff that you feel if you run your tongue across your teeth and they feel dirty. Well, then you just do a quick brush to get that off of there. But thorough brushing is when you get you want to brush on your gums and on the very backs of these molars get mixed a lot. So you'll want to make sure that you get back here, because that's a good place for bacteria to sit on your back tooth. And then the thorough is just all surfaces, tops, fronts, backs. And your tongue is also very important to brush. That's where a lot of bacteria sits. So if you go to bed with bacteria on your tongue, then that sits there and eats away at your teeth too. So it's important to do that. And the method that we recommend to use for brushing is to hold your toothbrush like you would just hold a pencil, so it's a nice light touch. You're not going to be jamming it onto your gums and damaging them in any way. You'll want to hold it. The method we use is called a subsulcular method, which is holding the toothbrush at a 45-degree angle and then doing circular motions on your teeth. You don't want to do it straight up and down because then it tears away the tissues and the cells on the gums. So you want to hold it at the 45-degree angle instead. And it's important, like I said, to get back here, which a lot of the times the toothbrush doesn't always fit, but it's important to get on the inside surfaces in the back and then along the backs of the front teeth always get missed too. So it's important that you can get in there with your toothbrush to get the bacteria off of those teeth. Now that I've told you everything about that, brushing, do you have any questions about brushing?
I don't think so.
Okay. I will go ahead and show you the proper way to floss then. You should use an 18-inch or approximately 18-inch piece of floss, and you'll want to wrap it around both of your index fingers until there's an inch or two of space left, and then you will wrap it around each tooth in a kind of C shape like this, and you'll want to just kind of wiggle it back and forth up the tooth, and you'll want to do that twice between each tooth to make sure that you get everything on both sides. You'll want to make the C shape that way and that way. And then the back tooth is also really important for flossing because a lot of people miss this back side of the tooth, which is then, so that tooth, we see a lot of decay in that tooth. So it's important to get the tooth, or the floss back on that tooth as well. I think, yeah, that's everything about flossing. Flossing is pretty basic as long as you know the proper way to hold it and to use the C shape. Oh, also, if it gets stuck between two teeth and you can't get it out, don't force it out. You'll want to just let go with one side and then pull the floss through so that it just comes out easily and you're not hurting or risking hurting anything. Do you have any questions about flossing?
I don't think so.
Okay. Then I've got a napkin to put on here for you before you get started. Alright, there's a toothbrush and toothpaste here for you, and you can come over to the sink. I'll kind of guide you through, make sure you're doing it correctly.
There isn't any certain amount of toothpaste you need to use, is there?
No, just enough so that you can do it for a good 2 to 3 minutes without running out of paste. That's a good circular motion. You got the 45-degree angle, so that looks good. Also make sure not to forget the tongue because we don't want any bacteria to sit in there as well. We recommend to have brush for 2 to 3 minutes usually for adults. There's some battery operated toothbrushes that have self-timers inside of them, so as soon as you turn them on, then they start a timer and then they buzz at you as soon as your timer's up. My toothbrush at home has 3 minutes, so it can tell me when my 3 minutes are up, so I just keep going until that buzzes at me. Good job getting the tongue. it's important. I know for kids they recommend just a pea size of toothpaste on the toothbrush because a lot of the times kids will swallow it, so we don't want them to be swallowing all the toothpaste, but adults, just a nice little strip to cover the bristles on top is a good amount. Alright, looks pretty good. And I've got a piece of floss out here for you. If you want to grab that, I can get the mirror to show you so you can see how you're flossing. Good job with the back teeth. Those are ones that get missed a lot from patients. C-shape looks good. A lot of times with kids, they will not want their teeth flossed or brushed, so it's important when they're young to make sure that we are informing them of the things that can happen if they don't brush their teeth, and the cavities can happen and how it can lead to much worse things. So some parents have just make it a nightly thing with their kids to show them how to brush and floss while the parents are doing it, so that seems to be a pretty helpful technique. Good. Alright. Then now for the fun part, I've got a disclosing tablet here for you. And that you chew up and swish around in your mouth a little bit, and then there's a cup of water here for you to rinse with. And that will allow us to see any places where there's plaque on your teeth that we've missed from the brushing and flossing. Sometimes they're purple and sometimes they're pink or blue. They just kind of depends on the tablet that you're using, but they all serve the same purpose. Any places where it's the darker color is where the plaque is still sitting on your teeth. So you can always see the fronts and backs of the teeth, sometimes in between the teeth. A lot of times the plaque will be along the gum line. So that's where in the back you can kind of see where it's a little bit darker. So those are just areas to be more aware of for plaque, and to make sure that you're getting in there really well with your toothbrush and floss every morning or night. As long as it's every 24 hours, that's a good time frame. Brushing your teeth twice a day is what we recommend to keep everything under control, but at least once a day it needs to be done, because we don't want the plaque to start to build up. If it builds up, then it can start to form white spots on your teeth, and those will just get hardened, so then we can't get them off for you when you come in for your cleanings. And so then we kind of just have to look at other options at that point. But that's all I have for you today. Do you have any questions?
Is there any difference between just a piece of floss and they have like those picks, you know, that they're already cut? Do you recommend one over the other?
The floss comes in waxed and unwaxed, and we recommend these more because you can change the spot on the floss, so you're not using the same little dirty piece of floss in between each tooth. So,
Thanks.
you're welcome. Anything else?
Nope, I think that was it.
All right. Well, I can take this for you. Thanks for listening to what I have to say, and I hope you can pass some of this information on to family and friends that you know and warn them of things that diseases and things. So thank you.